Hey guys, welcome to Horrible Decisions.
This is the second intro taping because I definitely fucked up this doctor's name and told her I was trying to get free medical advice. But welcome.
Welcome, y'all. It's one of the days of the week, whichever y'all is listening to us. I give up on that. I want to shout out to everyone who is at their desks and those of you who are not. Those of you who are in your car, I know when I tweet, I'm like, whoever's going to work right now, whoever's going to their lovers, whoever's leaving their booty call, listen to the new episode. So thank you guys for tuning in to another episode of Horrible Decisions. This is your girl, Mandy B, a.k.a. Full Court Pumps, a.k.a. That Bitch, a.k.a. Pet the Stallion. And I'm going to come up with a different a.k.a. because it's 2020, goddamn. And we getting through this goddamn shit. I'm also excited for this episode. Weezy did a great job with finding our guests. And y'all be trolling us about not having motherfucking professionals in here.
Let's not get too excited because she might fuck up.
I'll try not to. You know, she's going to try not to. Can you introduce yourself to our audience?
Yes, I can. Hey, everyone. My name is Dr. Kristina.
Hey.
Yes, Dr. M.D. That's 4 years college, 4 years med school, 4 years residency, and I am black.
I love it.
By the way, my name is Weezy if you've never heard this show, and we are so happy to do this episode. This is inspired by multiple injuries that I have had, and actually one I didn't even realize that started at the beginning of the show, the missing fucking condom. Like...
I heard that episode.
Did you?
I
and
did.
then I talked about not only condoms got missing. I shared a story, and I think we talked about it with the last doctor we had on. I don't like period sex, so like I've put makeup sponges up in my pussy to stop the blood, but it still feels like a pussy ball. And that shit, I don't have my.
Get lost too.
I've had my friend have to put gloves on and pull the fucking sponge out of my pussy, and she did say that was not good. Weezy also goes by one of her AKAs is PH Patty, so we do try to kind of give, a little bit kind of doctor shit, but we don't really know what's up.
We try to give doctor
shit.
Well, we've never had an OBGYN, I think. No.
OBGYN.
So my friend that came, Dr. Kim, who I mispronounced you with, is a naturopathy doctor. So, I mean, she obviously, does childbirth, all kinds of stuff, but like, it's more like she's cured cancer through food. Like, she's that type of doc, right? And so
a scientist, kind of.
That's how I don't believe in science.
I mean, I don't, but if you call, curing cancer through food and shit.
No, I think that's the most natural way. Science is more other doctor shit. Like you got MRIs and all that.
It is science.
But I think the OBGYN is so important because obviously we always talk about our pussies on this show. And honestly, we had the duel on. Y'all got mad at her because she wasn't.
Did you listen to that episode, by the way?
I did listen to that episode.
So I want to ask you. I wanted to ask you because, of course, that was one of the episodes where we did get a lot of feedback because she was someone who was practicing a form of medicine without being licensed. But I wanted to ask you your thoughts.
Form of medicine.
Because she's a support people.
A support. Yeah. But I wanted to ask you because a lot of the feedback, the negative feedback that we got specifically was from the healthcare professionals that do listen to the show. And she did kind of speak down on the practices in the hospitals and nurses and doctors. And so as an
about
OBGYN.
Like babies on your back.
Yeah. What were your thoughts of what she was saying?
I think that a lot of people are either you have the people who want to do everything quote unquote natural. What is even natural these days?
Right.
Is it without an epidural? Is that just considered natural? Is it at home? Is it in water? Is it things like that? So, it's one of those things where I think that patients have the right to choose. Okay. So they have the right to choose how they want their birthing experience to be. That's obviously based on what their medical conditions are, right? So if you're a high-risk patient, you should be delivering in the hospital.
How you know if you high risk? Like, I be whining about everything, so I'm probably high risk.
You're not. You're probably not high risk. Do you have medical conditions? Diagnosed medical conditions. So high blood pressure, diabetes.
I do. I got eczema.
No, eczema
ain't high risk. Okay,
I might wheeze in the middle of them.
My bad.
My ex used to say, "You the type of bitch to die in childbirth the way you be acting." I was like, "I am," because I be crying.
But crazy things can happen in childbirth.
It's so crazy. My sister actually, she's high risk, and it's weird because she's diagnosed with epilepsy, and because of that, it changed her whole life because they wouldn't give her a driver's license. Because her seizures were uncontrollable, and she went atheist after finding this out, and then also resulted to not I don't want to say it was the main cause, but she became a lesbian. But that was because she felt like she could never give anyone a family because they told her it was in her best interest to get on Mirena or get on some sort of birth control because she's very high risk to die during pregnancy. So I think that that's interesting. I do want to ask you, as someone who works in the hospital, and I don't want to get too far off the outline that Weezy made, but you said that it's up to the patient how they deliver. In the hospital, is that really the case? Like, could I stand up and deliver the baby if I wanted to?
I mean, I think it's important to choose an OBGYN that you feel comfortable with, and that's going to let you do, what you want to do. I'm perfectly comfortable if somebody wants to stand up and deliver, if somebody wants to deliver on their hands and knees, if somebody wants to do any of those things.
How many babies you delivered?
Close to 1,000 at this point.
1,000 fucking
That's a lot of vaginas to look at.
Do you have any kids?
I don't have any children.
Thank fucking God. You've seen them all. You're like, ugh.
Yeah. I mean,
how many of them have shit on them when they come out?
I would say
out of 1,000. Probably 50% of people shit on themselves.
Bro, that is a high ass number.
Yeah, it's very common. In fact, like when you shit on yourself, we know that you're pushing in the right place because, like, to have a baby,
you be like, there you go.
You have to use the same exact muscles that you do to take a shit.
And the way I drink coffee, it'd be a running shit too.
So if there's something in there, it's gonna come out.
Have you had? I don't give a fuck about the outline. Have you had an experience where you were like, yo, I should have went to school for something else?
What do you mean by that?
Like something that just was like, holy shit, I'm not ready for this. This is not what I signed up for. Like,
no, it's exactly what I signed up for. I love it. I love delivering babies.
I want you to repeat that. We were just talking about shit, Dr. Kristina, and you said, I love it.
Nothing grosses me out. I mean, I've seen
Okay, but what came close?
So, what grosses me out the most is a retained tampon. So
what?
A retained tampon. So there are women who sometimes maybe they use 2 tampons during their menstrual cycle.
What?
One gets left behind.
I've never done that.
I've never heard 2.
Yeah, some people, their period is so heavy that they'll put 2 in there, which I don't recommend because, one can get left behind. So I've had people forget that they put a tampon in.
Like, you just switch it out.
30
what did it do? A tampon and a pad?
Yeah. Some people, it's so heavy they bleed through the tampon, they bleed through the pad, in an hour.
Sorry for the male listeners, listening to this portion.
Yo, what's up with the? Look at me, like I got my questions too. Nah, but for real though, what's up with the thing with pads versus tampons? Are pads really better for you versus tampons?
I don't think one is better than the other. It's just your preference, honestly.
And it's funny because when you Google it, there's I've seen doctors saying absolutely go pads, blah 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 blah, and I'm like, but bitch has been using tampons for years.
Yeah. I think when it comes to the tampons and the pad conversation, it's more so the amount of times that you change it, which you can cause. What is it? It's some sort of shock that can happen.
Toxic shock.
Yeah, and that's a real thing.
It's a real thing, but it really takes a lot to get toxic shock syndrome.
How much?
You probably need to leave that tampon in there for a month.
And 3 of them.
You seen somebody with it?
I've never seen anybody with it.
Oh,
usually
they've been lying to us, dog.
I know. You could keep a tampon in all day, and for hygiene purposes, I recommend changing your tampon at least every 4 hours.
I don't use
that's what I've heard.
pussy.
But
that's what I've heard. It's weird because I mentioned recently, and I'm not sure if they just change what goes into them, but I've been wearing tampons for as long as I can remember, since I was in 6th grade, 5th grade, and not until recently, by my 2nd day, I'm agitated because of the tampon. Yeah. So I've been looking and talking to my friends about the organic tampons, and Lola is one of our sponsors, and they have organic tampons. Yeah. So just trying to change because you are putting it up.
I know. And
also, I was reading about the applicators. Hold up. I want to get into our vanilla shit because it actually has a little more medical too. Okay. So there's a woman, Jessica Drake. I don't know if you guys remember her. She was Stormy Daniels kind of time. And I crossed this thing on the internet on YouTube where basically she is a guide for seniors to have sex. So I'm just going to go into this really quick because I want you to tell us a little bit about what you know with old pussy. From thefastcompany.com, meet the woman leading a sex revolution for seniors. Joan Price, she was an English teacher, got divorced, and basically decided that she wanted to talk about sex with people. So she is now the face of practical sex advice for seniors who don't lose their libidos just because they've been on this earth a little bit longer. And there is a majority of seniors, actually the range of age, it says is their 70s that are the most sexually active. So she got together with Jessica Drake and made a video, it's erotic, on Pornhub, where basically they show old people how to fuck. And I just want to play the clip so you guys see.
I don't know if
I don't want to watch it, but like it's just a clip.
Okay,
it's on YouTube, but this is what it looks like.
Jessica Drake's Guide to Wicked Sex, Senior Sex Edition. This volume is dedicated to helping people in their 50s.
She look good for being old.
50s is not that old.
They look 80.
In this movie, I'll share some of the important ways that aging affects.
Bro, she does not look 50.
No, she ain't 50. Oh my gosh.
Satisfying sex. I'm Joan Price.
All they did was kiss, and that looked gross to me.
Right.
To Wicked Sex, Senior Sex Edition.
Why does it drive us nuts when old people what the fuck is that? Why did that
It's just I don't know.
Maybe they should have had like a black couple, because then at least Idris like 80, but he looked like 27.
I think that there's something about people looking like whether it be your grandparents or like family or people you respect. I think it's just
you know why? Because it looks like their teeth might fall out.
This is just y'all like 30 years. Like y'all gonna be fucking
30 years, nigga. I'm only gonna be
but
60.
he's right.
60.
Right.
But I ain't gonna look like this because black don't crack.
Can I ask how old you are, Kristina?
32.
Okay.
Yeah.
So 1,000 babies at 32?
Yeah, close to 1,000. I don't know. I don't count anymore.
How many of them were twins?
That's a good
Twins,
question.
probably about 5% that I've
Oh, wow.
delivered.
Oh.
Like 5%. Huh. So twins are common, more and more common now with IVF and things like that.
How excited are black people when you walk in the room?
So excited. I love seeing black people. They're like, yes, I searched you out. I wanted a
You
black
gonna get my
doctor.
shit out, sis.
Exactly.
I love that, especially because again, our episode with the doula, she was Latina, so I didn't think that we could really have that conversation. And we see it being talked a lot how black women are not taken seriously when
but
they go to
Latinas
the doctor.
are very high on that list too.
I mean,
They're very high.
I just want to talk about black women specifically because that's the focus. And when they talk on Twitter, Serena Williams had her issue.
Serena Williams shit was crazy because it really truly shows you that money means nothing. But I mean, I want to. There are black Latinas, and I really do want to include them in this because when I saw the percentage, it was only off by like 3%.
Yeah.
And there is a whole fucking thing about people not listening for some reason, and I don't know what it is.
And it's crazy. Black women are the most likely to die in childbirth.
Right. And that's what I read. That's why, like, I don't want to Gina Rodriguez this conversation and include Latinas because, yes, they can be included, but what people are saying as far as the risk that black women are having, specifically someone like even Serena who had fucking... who's a millionaire. And I think Beyonce even went through it maybe with one of her pregnancies. She had complications.
She doesn't put out a lot of
details, but it was a tough pregnancy.
Right,
and so as a black woman who is a professional in this state, like, do you have these conversations with your counterparts, your white male doctors or other, like, what is the conversations like surrounding this?
I definitely think that it's becoming bigger with all the publicity that's been happening surrounding it. So, I definitely try to have conversations and things like that. But the issue is that some people don't think that they're biased, right? So, there are a lot of doctors out there who are like, I treat everybody the same, right? And, no fault to them because that's truly what they believe. They believe that they listen to each complaint equally,
right?
But there is just a certain implicit bias that we don't understand necessarily, or we don't know about ourselves.
Do you think that there's any truth to? I was reading something about black women, dying in childbirth, and saying that they believe that some of it has to do with not asking for help.
So there is some truth to that, actually. There is some truth. And I think that a lot of times black women don't feel comfortable with the providers that they're seeing, right? So if you have a doctor who you are just like, literally, I'm here because I'm pregnant, I need a doctor, I guess this guy or woman who, it doesn't look like me is going to deliver my baby. Maybe that doctor that they're talking to is a little, short with them, a little older. I don't feel comfortable really talking about them with my issues. then yeah, certainly things can get missed because, you're not necessarily speaking up. But that's not your fault, right?
Right.
And it's not necessarily the doctor's fault. I mean, I think that we can put it on our physicians that they should be asking those questions.
I wanted to ask you before we get into our next segment. So my best friend, we went to high school and everything together. She just graduated. She's now a nurse anesthetist. So she administers anesthesia. And she actually practiced in Alabama and is now in Georgia. And she said that she's noticed where patients, when she's walked into the room, they've requested another anesthesiologist or something because of the color of her skin. And she knows it's because she's Black. Now, we're in New York. Is that something that you've experienced from patients, maybe not wanting you?
I think it's a little less common. I
can see it being age a little too.
You
look really
you do
young.
look young.
Yeah, I do. I get that all the time, actually, all the time. But I practice in Philly. Well, I trained in Philly and I practice in Camden, New Jersey. And so, they're both very diverse areas.
Right.
And so I really haven't had a big issue. I have had like a little side eye, a little bit. Like, are you old enough to be a doctor? Like, yes.
Because see, I feel like if it was me looking at you and I'm pushing this baby out in pain, I'm be like, first of all, get the nurse out. She's only 12.
But you do look young. Very young.
I get that a lot.
Real quick, back to the senior thing. I do want to know, have you had any, first, I guess I should ask, do you work in an emergency room? Do you have a private practice? Like, what's your day-to-day
I
like?
work in a hospital.
You work in a hospital?
Yeah, I work in a hospital. I see patients in the office. I'm in the hospital. I do deliveries, C-sections. I do surgeries. I do all that.
With the seniors, I read a lot of comments about people, like, scared about being hurt during sex when they're older. Have you had old people come in with injuries or, like, heart attacks or...
I haven't particularly, but I know that's definitely a thing. Like, some old people can't walk up a flight of steps, and if you can't walk up a flight of steps, like, that means that when your heart rate goes up,
I was about to say,
you have an issue.
Sex,
So
I be burning more calories having sex than I do sometimes just walking a mile. Like, that's a lot of fucking work.
And as you get older, heart disease is an issue.
It's
so
a real
There's
thing.
a clip I had of my grandmother. I really was trying to find it, but I've been in between wanting to share my family and not on Instagram because most people enjoy it, but then there's always those evil people. You know what I mean? They're like, oh, you be posting. So my grandma told my mom that she wanted to have like an escort come in and have sex, right, with her. And my mom laughed. She was like, what do you want it to look like? And my grandmother says Tahitian. Now, my grandmother is Black. And everybody's like, where the fuck did she get Tahitian from? So I go to the nursing home a week later to check on her. And this guy's like, oh, Johanna's my favorite, blah, 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 blah. And he says his name. I'm like, what kind of name is that? He's like, it's like a Samoan name, and my family's from Tahiti. And I was like, this is the one she wants to fuck. So we made this joke with her at Thanksgiving. Like, so what if, you got a bad heart? What if something happened to you? And she said, I mean, it's a good way to go. And I'm like, yo, if I was living in a nursing home, my life's just okay. How much more I'm going to see my grandkids? I would rather die fucking
take the risk. You take the risk, right?
I would.
Yeah.
100%.
Yeah.
Then I found out that the Tahitian man is also the one who bathes her. He's not that attractive, but I guess So my mom was like, did you know your grandmother's getting bathed by a man? I'm like, so he's a nurse. Like, I don't understand what the problem is. She's like, no, it should be a woman. I'm like, Ma, that doesn't make sense. Like, come on, that's fucked up. So my grandmother goes, I have no problem with who washes me. I don't know if you guys have ever seen, I'm sure you have. So where she takes a shower, it's a whole room. Like, you walk in, there's seats. You could, I mean, it's bigger than this studio. It's huge. And like, there's a bed. So, I mean, she probably get comfortable as fuck.
Yeah.
But there's also a lot of sexual abuse in nursing homes too, with the elderly. Have you heard anything about like the STD and the rates of?
I have, yeah, and I'm actually more and more testing, older women for STDs. Yeah.
Really?
Because
they're not using condoms at that age.
they're like, I can't get pregnant, right?
They can't get pregnant.
Like, what's the point?
But a UTI could really hurt you when you're old.
End up in the hospital in the ICU with a UTI when you're older.
Oh, wow.
Yeah, it's serious. It's really serious.
At what age does that become more serious? Like, I know we're talking about elders, but I know we have some people listening and they're, late 30s, early 40s, and maybe even into 50s. And I know that also is the time frame for menopause where your period stops.
Yeah.
And maybe once your period stops, which can happen in my family, it does happen young. I believe my grandma went through menopause at like 38.
Okay, wow,
so
that's early.
My family, like, and my mom, my mom kind of old now. No, she's not. I'm lying. I think she just turned 40, but she was shocked to even have a period because she's like, I thought I was done. So my family does have early menopause. So for the listeners, who are around that age, what do they hone any more risk, like you said?
I would say that the risk probably increase around, I would say 70, 75.
Oh, okay. Okay.
Because 50 is young these days. 60 is young these days.
It all depends.
Yeah, I don't know. We got 70-year-olds. They probably like, what is a podcast? Like, them hoes
My
don't know what
grandma
this shit
calls
is.
them a palmcast. Before we get in, so this horrible decision for this week is sex injuries. I want to know if either of you guys have ever had one yourselves. Besides the missing condom thing.
I have not.
Well, there's the missing condom. It's funny. My mom came on the episode. If you guys want to go back, while she was having sex, her partner had a heart attack, so she had to get him dressed before the ambulance got there. As far as sex injuries, nothing. I mean, shit, an abortion. Nah, let me stop. Nothing that I've ever really. I mean, there was a tool in my pussy.
But it's not injury.
Okay. So I think
the pregnancy the injury?
It was a problem, goddammit. Shit, it changed my body a little bit. I would say not really an injury where I had to go to the doctor, but so one of my hoes, one of my lovers, one of my little Jones, he doesn't really like sex for real. He does, but he doesn't. Okay. He prefers oral. And so I remember...
Does he know why?
No, I don't know. Maybe his wife doesn't give him head. I don't fucking know. But I don't know.
We were ready for that one.
I said one of my hoes.
I did. All right.
I don't know. But
maybe his wife doesn't suck his
I don't know. That's, I remember one time in particular, we were together, went back to the room because he was in town. And in one night, I performed fellatio 4 times to the extent to where he came every time, but I gave him head for 4 times. And literally, I had never, mind you, I just had my wisdom teeth taken out and I haven't been able to open my mouth because I had trismus. My jaw hurt worse then than it did after getting both of my wisdom teeth removed.
Trismus for Christmas.
I'm sorry, I had to.
I did it out.
I did though. But not that it took me to the hospital or anything, but I think I pulled something from sucking dick that long.
It's possible.
So I got trismus from sucking dick.
So I've never had it from sucking dick too bad, but eating pussy I have.
Oh, my tongue hurt eating pussy.
My tongue has hurt.
Yeah. I mean, all muscles, right? So when you use
overwork them shit.
When you overwork muscles, just like when you work out, they get sore.
This is what I wanted to know if it was true. So I'm really curious if this is real, right? This happened to me twice, and it was both vacations with Old Bay, where, I don't know if it's real, because I've been sick after. So maybe, okay. We do this weird hotel shit where I start going upside down and shit, dog. And I don't know why, but he be fucking my face on the edge of the bed and my fucking throat is killing me the next day. So then I went to the gay club the next day and I was like, oh, my throat hurts. I think I'm sick. And they were like, no, bitch, you have a bruised esophagus. Everybody knows it's a thing. I was like, is that?
Where in your throat does it hurt? Where?
So my tonsils are huge, right?
Okay. All right.
So I could feel it
like right up here.
Yeah.
Okay.
And it's immediately after face fucking. And I'm like, ugh. I have to just drink tea to soothe it.
Yeah. I would say that it's probably not your esophagus because your esophagus is a little bit deeper, but it's probably your pharynx, which is basically the word for throat.
And that's what gets swollen.
So that's what can get swollen. There's a lot of soft tissue there. There's, easy bruising in that area. Okay. So your esophagus, though, if you bruise your esophagus, that's down here. You might have chest pain, so it might be a little bit deeper. And that could be an emergency because if you rupture your esophagus, that can be very
I'm about to tell that nigga, don't rupture my pharynx. Because basically, you know what I'm saying? I need to use my voice, and I came right in the studio and was fucked up, dog.
Yeah, so it's probably a little bit of your voice box in that area more so your throat than your esophagus.
I be using that as an excuse now. I had a nigga come over last night and I was like, so not only were my wisdom teeth pulled out, so my jaw isn't opening all the way. I said, I have to talk tomorrow, so I can't really suck your dick like that. Like
I have
my
nothing to say.
mouth, like my mouth has to work. And like even with smoking weed now, we went out. I only had one drink with him. I said liquor changes and backwoods. Like I don't even smoke backwoods no more because my voice, man. This is how that's how I make a living.
No,
so
I know,
like,
smoking has gotten my voice like
it'll make it coarse.
Crazy.
Yeah.
Like, I already have a rasp. Like, and mind you, we just recorded not too long ago. Shout out to Sid and Risue. When they came on, by the end of the episode, my voice left me.
Oh,
I was
man.
like, thank God Weezy was here with guests to finish out the episode. I literally couldn't speak. So like now that when I go out and stuff like that, I'm not drinking as much anymore and I don't do backwoods. I'm like paper only. And yeah. And then I don't be sucking dick like that either. So I be like, damn.
I don't suck dick like
I gotta
that.
talk tomorrow.
I be like, I gotta record tomorrow. I can't suck your dick tonight.
So here's what happened when I went to the doctor with my sex injury last week, right? So I was squatting. I know exactly when it happened. I felt this pinch right on the side, and I was like, okay, maybe it's just like a nerve thing. Then a bitch started doing some acrobatics 2 days later. In the middle of this threesome, you know what I'm saying? She starts holding my legs open, and now I'm leaned into her, and she's like spreading my legs. And that's when I felt it. Like, it felt like something almost like just started slowly like ripping at the seam. It was crazy. Ooh. He saw my face. And he already knew my leg was hurting, and I didn't want to like ruin the threesome. So I'm just like, oh, let me see you do it. Let me see you fuck him. So I was fucked up. So I get to the fucking urgent care, and I'm like, yo, I was squatting. And then like shortly after that, it aggravated. He was like, really? From walking? From being back in the gym? And I was like, no, from fucking, sir. That's exactly what I said, from fucking, sir. And he was like, okay. Well, he was like, I can tell you. He's like, because you've torn the ITU band and it's from your hip to your knee, he's like, squatting is going to be difficult. Bending over is difficult. So I would suggest no going on top. And I'm sitting there.
I would have been like, I don't do that anyway.
An excuse.
I said, sorry. I said, I thought you were already going to give me a Valium. This is another gift. So I don't need to get on top, is what you're saying. I said, can you write that down and tell him how long
Right,
it is?
That is the gift that keeps on giving.
I
Nigga.
cannot
These restrictions.
believe when he said you can't get on top. I said
That's
so
easy.
That shit was hilarious. So the nurse is like typing, you know, when they're like putting in the notes or whatever. I said, make sure you put that in there so I can print it out and give it to my boo. I almost said my man. Oh God. So anyway, top 8 sex injuries. Okay, most common from the sun.co.uk. I was so high when I did this outline last night. Number 1 is vaginal tears. I thought
Tears.
and I said. I said, well, I've had that before, I think. I've been really upset. Do you remember there's a Sex and the City episode where she goes, my vagina's depressed? Because like she was having some shit going on. I really thought that was vaginal tears, but it was tears, and I'm dumb.
I think I'd have had that before.
Yeah, it's the entrance to the
Is
vagina.
that like when you feel it in your
Very
stomach?
common.
Or?
Well,
No, bitch,
Because my
it's
stomach
like
ain't
a
your pussy. So it like goes up there.
It's vaginal.
My
So
stomach
you-
be hurting after sex sometimes. Like, damn, nigga, you was in my stomach. You ain't never fucked no big dick and your stomach was hurt after.
No,
like,
my cervix.
cervix. So
Oh, is that what
it
it is?
actually can't get into your stomach. Like
Well,
there's
bitch, it's
no
close.
physical.
It's the bottom by my belly button be hurting.
I think it's my cervix.
I be like, damn, nigga, you
It's
fix
your
my belly
cervix.
button?
It's your cervix.
How
It's the only
deep are
thing.
we?
What do you mean?
It go real deep.
What's the
no?
average pussy depth? Like 5 inches?
About 6 to 8 centimeters.
So how them niggas be getting
Wait,
all the way in?
centimeters?
Inches, sorry. 6 to 8 inches.
Nah,
So
and
how
I
do
be
you get
fucking
in?
12-inch dicks, bruh.
You know,
What are the
the
four
vagina
going
is
in my
an amazing
stomach, bitch?
place.
It be
The
going
vagina
in my
is an
stomach.
amazing place.
I
It can
told you,
stretch.
it be, girl.
You know, it can do amazing
girl,
things.
Dr. Kristina, how do the big dicks get in?
How?
We need to
and
know.
I be spreading my cheeks and I be like, put it all in. That's how I know it's going to my stomach.
It
But
can
just tell me
stretch.
where it
can
goes.
stretch. So it goes just inside the vagina, and the vagina again can stretch. It's an amazing place. It can stretch, can go,
But
back
it don't
to
go
down
longer.
to the normal size.
It
Because
can't
that's
go
the
longer.
thing that
It doesn't-
confuses me. If I'm 6 inches and you're 10, and
Where
you
the
put the
other
whole
phone?
thing in, where that shit went?
It's in there. It's in there. So it stretches all the ligaments and all the tissue out.
And it go to my belly button. I told you. And these niggas don't be curved. I like the straight dick niggas.
I
The
don't
little
know.
hook niggas be hurting.
Yo,
so I know
hate
when they
curves.
go
It's
in,
the
they go in
side-
this
the
way.
side,
That
that's
side
where
shit's
all
some
the
bullshit.
muscles are.
Yeah, fuck that shit.
That's where all the muscles are. So if
That's why you jump.
if it's hitting the side, like that's
Bro,
why.
we were fucking the other night, and it was so funny. I didn't want to laugh, but so we were drunk, and he's got a curve on his dick, right? And and it's not like it's the craziest, biggest dick. It's big enough, and goddamn, that shit be really hurting. So he turned me, and we started fucking. He was fucking the shit out of me. He goes like, "Yeah, now I know how to fuck this pussy." I was like, "You found your angle, baby.
Yeah.
You found that angle."
Yeah.
I don't like the curved dick.
That shit sucks.
Yeah. So I would say that the vaginal tears are the most common. It's like, women who come in and talk about how they bled after sex, usually it's because of a tear. And really the most severe I've seen, so you can tear right underneath the cervix, and can... Not your stomach. It's still in the vagina. It stays in the vagina. But I've had somebody come to the ED where they literally bled 2 liters of blood from a tear. Yes, they needed emergency surgery.
Ain't that a Coke bottle? The big one from Domino's?
Yes, exactly. Exactly. They needed surgery, needed to put sutures in there.
How old were they?
It was a young girl. She was probably, if I'm remembering correctly, like 18, 19 years old. And the thing is,
she had a big old dick she wasn't ready for.
Why are you so petty? This nigga just put fucking 2-liter Coke can.
It's a lot of blood.
You so petty.
A lot of blood. I think she ended up needing a blood transfusion.
Whoa,
yeah.
from dick?
From dick, yes. And so the thing is, most people, they don't report, when they report these injuries, they don't want to say it's because of sex, right? They're embarrassed. They kind of try to say, they're like, oh yeah, I don't know what happened. Like we were having sex and then all of a sudden, like I started bleeding. Like it was obviously like rough sex.
Yo,
right?
Speaking of bleeding, keep it 100. Can a nigga fuck your period on?
I was just about to ask that.
Can they fuck your period on?
Yes.
Because I'm telling you right now, I feel like I've been fucked, and I'm like, yo, that shit was supposed to come in 2 days, but you got it out.
That shit happens.
Not necessarily. So if it's going to come, some blood can start to come out early because of sex.
So let me ask you the other part of that. So I done fucked on like my last day, and I know it's my last day because I know how long it lasts. And then they done fucked the whole day 2 period come back where it's heavy as fuck again. Can they fuck you to keep your period on as well?
No, it's not going to stay on, but
this happened to my body.
The thing is, the blood comes out a little bit quicker. Oh. So instead of like working itself out, it comes out quicker all at once.
So basically, if you want your period to end fast, you should just fuck yourself to get it out?
Get it all out.
Nah, that's nasty. I'll pass.
At some point, your uterus is going to stop bleeding, and then all the blood just has to work itself out. That's why it's dark at the end.
So on the other end...
Because it's like staying in the vagina.
On the other end of the spectrum, the second most common injury, something that we don't have, but I felt like I've done it before, is a fractured penis.
You felt like you fractured a penis.
I feel like a nigga was pumping so hard, he went in and maybe missed the hole, and then I felt like,
I feel like that sometimes when I'm like fucking from the back.
From the back, yeah.
And I'd be like pushing
and it'd be like, if they had a fractured penis, you need medical treatment.
Oh, so now I ain't fractional penis.
Let me show you this picture of this dick I thought broke. Hold on. Here's what my other question. When I'm in the picture, bruh.
So you took a picture of this dick.
Here's what happened.
Right after it broke?
When I'm fucking reverse cowgirl, I feel like I'm about to break a dick.
So honestly, when that happens, you can usually hear a pop. Like, you can hear a pop. Like, no, it's literally like, it's a very, like, sorry to this man experience.
I am not.
Bro, it said there's like 3 cylinders in the penis, and then when that shit pops,
so the penis is actually not a bone like people say it is. It's not a bone.
It's just blood.
But it's just a lot of blood.
People think a dick is a bone and it could go down.
People think it is. They do. But anyway,
now
when it's broken, it's basically they're rupturing all that blood, the blood vessels that are running through the penis. So they're rupturing all of that.
Yo.
And then they need
I got another one. So I was seeing this guy, Hospital Dick, right? And he got that name because he was trying to fuck this girl. I guess she was too, quote unquote, narrow, whatever. And she ended up going to the hospital because his dick was too big. Yeah, in her defense, it was. How can a woman receive, or like, I guess if you have someone with a big dick, get your pussy to fit the dick?
Lube, a whole bunch of lube.
A whole bunch of lube, yes. Initially a whole bunch of lube. So as you have sex with this person more and more, the vagina is going to stretch.
Like a little keyhole, it fit now.
Because, I mean, a baby's head comes out of there. So a baby's head is like this big. It comes out of there. So it can fit, but, not initially. Like, it's not going to happen right away. You can't just force it in there. So
so Canadian Bay has such a massive dick that I like can't even suck past the head. And so it's not enjoyable for me because it is so big. Yeah. And with him, it wasn't even to where I felt embarrassed. I put lube by the side of the bed. And right before we went to fucking, even without him knowing, I grabbed that lube and just put it on myself because his dick was so big that I know that it wouldn't be comfortable. And then also because I do use condoms as well, like the friction already there, if I'm not all the way wet, it's just uncomfortable. It's almost unbearable for me. So, I mean, a lot of us women look at our vaginas as if we're not wet, it's us, or maybe we're not turned on. And depending on the time of the month, I know when I'm drunk, it takes way longer for me to get wet than normal. So I think a lot of us look at our vaginas as if we're not wet, oh my God, maybe we're not aroused. Maybe there's something wrong with us. And I think as women, we need to be okay with grabbing the lube and put it in there ourselves. And sorry, we're not waterfalls.
That expectation. It's the same thing with like squirting. Girls are like feeling so much pressure because men are watching these videos of women and shooting it across the fucking room. Like the expectations that men have for our pussy is wild. Women never made me feel that way.
I mean, after ovulation, you're going to be a little drier, right? Because your body really is meant to have babies. So
it's that shit, not mine.
I didn't know it was right after ovulation.
After ovulation, it dries up a little bit because then you're really not at risk to get pregnant, right? So your body wants to be more lubricated for intercourse, so it's more enjoyable, so that you have it before ovulation.
So I do the rhythm method, and I have to be honest. Sometimes I get scared because it's worked so well for me, right? Like I've been pregnant before, but I was younger and didn't, do the rhythm method or whatever. And now I've been doing it. Everything's been fine. Normally pull-out method is my thing. But when I'm definitely not ovulating, sometimes I'll be like, I could do a cream pie or two. You know what I'm saying? I'm curious to know, how effective is the rhythm method for, I guess, how effective is our ovulation cycle? Like, can I trust my body in that way?
If your periods are very regular, then you can. The only issue
they've only been off by 1 day.
Yeah, so usually as long as you're a couple of days after ovulation, the egg only lasts for 24 hours. So once you ovulate,
I don't do it the whole week.
The egg is gone after 24 hours. So after that, you're really not at risk for pregnancy technically. But the only issue is that if, let's say, for some reason your period is off that month, like your period can be off because of what you eat. Your period can be off because of stress.
So if your period is off
because you've been around a lot of other girls.
Simple.
Right. So, and if your period is off, that means you ovulated at a different time. And if you're, thinking about just tracking your period and thinking about ovulation that way, then that fails.
My friend literally got on the phone with me and asked what the app was. And I said, bitch, first off, I don't believe in science, period. But to me, there's no way an app is going to tell me what's going on in my body because there's nothing connected. It's just you're tracking your days.
No, it's not the app telling you what's going on. It's what's going on based on how your period is.
So basically what happens is 14 days before you have your period, you ovulate. So that's every single woman. 14 days before your period, you ovulate. Meaning that you don't really know until you get your period when you ovulate.
Right.
So if your period, so you can track it based on if your periods are regular, then theoretically you're ovulating at that same time.
But I think like for me, I have a lot of homegirls. So I'm constantly around a lot of my different friends.
And that can
and not only with the tour, but just traveling. I travel a lot.
Yeah.
And I noticed the months that I've traveled so much in a month, the next month it came a week early.
Yep.
And I'm like, God damn. So like that's why to me, condoms are just
a day or two.
Oh no, I've come 5 days early, 4 days early.
Everybody's a little different, but if you it only takes 1 month.
That's it.
Only
just
takes
to fuck it up. That's
I mean, don't get me wrong. Like condoms for casual partners, it's a lot easier said than done. But 4 or 5 nights a week, dog. Like my pussy gonna fucking be.
Honestly, you're probably good. Like right before your period. Like right before your period, you'll probably be good in terms of not getting pregnant. I'm not preaching that. I don't think y'all should try it.
Right.
Because
but no, I mean, I really was curious to know them and using it.
Right before your period is usually your lowest fertility.
One of the other injuries is common.
Interject real quick with a condom question. She was saying how when she's drunk, she feels like she can't get wet as fast. I feel the same. But I really do want to know something in particular with wetness and condoms. No bullshit, right? I'm always wondering, when I use condoms, right, I'm like, am I wetter because this is a newer partner? Or am I wetter because, like, maybe it's not soaking it up?
Condom? Oh.
Like, can you be wetter with condoms because, like, is skin more porous in the sense that, like, it'll, like, suck up, especially if they're
I see what you're saying.
Yeah.
I mean, I think it deals with the lubrication of the condom. So there's always, like, the condoms have extra lubrication. And so I think that's probably why you feel, like, a little bit wetter because of that.
Oh, but I'm not.
Yeah, but you're not. Most likely not.
And the air conditioner, is it true it dries out my pussy?
No, probably not.
Damn. Well, I'm going to use that excuse.
One of the other common injuries, which I don't want to talk too much about because this is common, is a carpet burn.
Carpet
of
burn.
course, I ain't fucking on a carpet. The next
well, you
one,
might get on the floor. That's hotel sex.
I ain't fucking on the floor. It's been, no. The next one is, which we talked about in the beginning, is missing foreign objects in the vagina.
Yeah.
What's the weirdest one you've heard of in the hospital?
Well, actually, there's more so missing foreign objects in the
asses.
anal area. Because, I mean, the vagina, you know, it has a limit, right? So, like...
But the ass
Wait, the ass don't have a limit?
Well, the ass goes all the way up into all of your intestines. So it can travel far up there to the point where you can't get it out yourself.
Maybe the nigga was in my intestines.
Yeah, yourself.
I do be having anal sex, bro. And I be like, ooh, fuck it like it's my pussy. Well, only when it's like regular, like we done eased it in and he's going in there.
Like it's my pussy.
Yeah, like I be
I
like,
would say the colon, it's all connected,
that
but
shit hurt,
there's a lot to get to your intestines. So it's a lot to get there. It's like, you know.
I mean, I be
Dr.
past the
Kristina, are you
6 inch mark.
single?
I am single. Yes.
Well, these niggas gonna be in your DM. Shooting 32, a doctor, pretty. What?
The next one is also very common. It's back injuries. Duh. I done threw my back out.
Yeah. I mean, you should stretch before sex, like just like you do when you go to the gym. Stretch.
Can you stretch in foreplay? Do you have any ways of how you may be able to stretch and perform foreplay? Shut up. It's because, listen, I ain't even gonna hold you.
That is a good question.
I know, like, niggas be thinking I'm flexible, and I'm like, I don't know if it's because I'm little and they be big. I don't know, but I'm not flexible. So a nigga will, like, try to have my leg all the way the fuck up, and I'm like, okay, get off now. Like, my leg hurt. I know there's muscles and shit here.
I think
how
that
do you
in order
stretch during foreplay?
Like, imagine you eating pussy and you're just like this.
So, you know, I got a good one, I think. Okay. If you're eating pussy, right, and you're flat on your stomach, what's that thing? Okay. So, like, if your legs are down.
We can't hear you.
This way, right? Is that right? Can you, like, because you're stretching, right?
Yeah.
You're opening.
That's a good. That's what you
want.
want to do. Is you want to open your pelvic floor. You want to stretch those kind of hip muscles and
right.
and tendons.
So
and
I
things
got
like
on
that.
the floor and basically did the yoga pose, like the child's pose, I would say is what I just did. So you could suck dick in child's pose. Because I know the pelvic floor is mainly the main thing I need to open up. Even in missionary, when a dude pushes my legs back, like that, sometimes I go,
well,
oh,
it's
too
that,
tight.
and it's also your hip muscles. Your
I'm about
hip
to suck
muscles
dick and do
tendons
wall
and
sits.
things like that.
Listen, we used to have to do wall sits in volleyball and basketball, and that shit will really.
That would be really hard, Mandy.
Girl, I done gave head standing up before, so technically maybe I can do squats while I suck
What a
dick.
way to show your height. I gave head standing up.
They're like 6'11". I'm 5'1". All I got to do is spread my legs a little bit, and I done gave head standing up multiple times, and it's kind of fun.
That's a workout.
But
too.
I could kind of do squats while I'm sucking dick. So then,
yeah, I mean, it's really about opening the pelvic floor muscles and all these hip flexors and things like that. To
I guess that's the main thing.
Yeah,
because I think the main thing that I always get uncomfortable with during sex is when I'm getting fucked in the back, obviously the angle or whatever, and then if it's missionary, like spreading my legs too wide. I'm like, nigga, what porn do you think this is?
Yeah.
And they'll like push your legs down. I'm just like,
I don't like that shit.
I don't like it either. I try to take it, but it ain't for me. What was one of the last ones?
Food.
I do have an interesting one that I wanted to ask you about if you've ever heard this. Just a weird sex hospital thing. One of our friends of the show, Injector Zoe, is a nurse, used to work in an ER, and said that a lot of people came in for swallowing magnets. And it's like a sexual thing. Have you ever heard that?
I've never heard that. Swallowing magnets?
She said she saw like a few people, or batteries and magnets, yeah. And
batteries, you could die.
You could die from that.
We went on Craigslist.
They're caustic.
Or we had a Craigslist thing where someone wanted to swallow jewelry and wanted to pay women. Do you remember that? This was like in the first year of our show. And this guy had an ad out where he wanted women to swallow jewelry. And Zoe was telling me,
he
like,
wants you to die so he could eat you. Probably.
she was like,
cannibalism.
people love swallowing shit as a sexual act. She was like, I don't get it.
Is it like a kink or?
Bitch, we ain't saying it.
I haven't seen that kink.
Physiologically, it's not going to make you feel sex any better or anything like that I can think of. So
like, have you? I know you said things go up anally. What is one of the things that are like not a dildo that you've heard of?
Food sometimes.
Goddamn cucumbers coming to attack.
Paper towel holder.
Yeah, anything that's kind of like cylindrical, like round and cylindrical things. Yeah.
But it's funny because we also just had B. Simone on, and she talks about how she's never had a vibrator, but her friend bought her a toothbrush and was like, you can use that with a little zzz. And I know that like a lot
just
of
like
people,
regular toothbrush.
Yeah, but it's electric.
Oh,
so it got a little vibrating motion. It's the step to get into the sex toys.
Food and irritation was the next one. I am curious also about shit. She just said, with vibrators, right? I don't know if this is true, but I think it's true for myself. So I used to use a bunch of different vibrators, mainly like the womanizer and different clit masturbators, and I felt like it was making it harder for me to reach orgasm during sex, and I thought maybe it desensitized my clit. Is that true? Can you do that to yourself?
I don't think that's true, but I mean, I think that because
I read that it's not, but it's harder to reach orgasm during sex.
Man, that womanizer, I use it every night, and even when I was fucking 24/7, when we went 3 rounds, I was still coming multiple times, and I use the womanizer.
I can't
to go
come
to
as
sleep.
fast as I used to when I use. So that was what happened when I would use the womanizer. I could not come as fast as I used to. During sex.
I think mainly it's probably your body just knowing exactly how it likes to come, basically, or what you need to do for that. And then when you change it up, your body's like, what the fuck? We did it better when you were with by yourself.
Right.
My next question has to do with number 7 was pertaining to food. So I was with a guy recently who's vegan, but I don't give a fuck. I'm finna eat what the fuck I want to eat. But I was like, damn, can I suck your dick? Can I give you a kiss? Like, I know you don't eat meat, but are you allergic to these things? Is that why you're not eating them? And so before I kissed him, I was like, do I need to brush my teeth? Have you had anyone come in with an allergic reaction to maybe a guy who ate something and then performed head or kissing? How is that?
Yeah,
how does that work?
It is possible. It's very rare, but it is possible. The other thing is that there are some women who are allergic to semen.
Really?
Yes,
they get the redness?
Yeah, they like basically after the guy comes. Yeah, after the guy, it's something in the semen, like some sort of component of the semen. And after the guy comes, like they just get inflamed, like everything swollen. They can even get inflamed, like if they're sucking dick, and then it gets into they can get the anaphylaxis.
Do you know the stats of how many women?
It's very rare. I mean, I would say less than 1% of women, experience this, but I have had one patient, honestly, who was like, I think I'm allergic to semen.
Speaking of semen, cum in your eye. How do I save myself? Also, we had a home mail where the bitch said it was swimming in her eye. You know what I'm saying?
I don't think you can feel.
You can't feel sperm.
How you get pink eye, bro?
I listened to the episode. I was like, nah.
That shit was hilarious. She was like, I really felt it.
I felt it swimming.
Yeah, no, your senses. It's not that sensitive.
How can you help yourself when you get cum in your eye? Do you flush it out with water?
Flush it out with water. Just flush it out, warm water.
You'll live.
You'll live.
You won't get pregnant.
You won't get pregnant.
Okay.
So sperm can't actually penetrate the eye.
So our audio had a little bit of a blooper. This is why you should just not hire people like you, Eden.
What is that supposed to be?
The problematic shit that everybody on Flagrant says.
Hired?
You know what I'm saying. Young people.
Latino.
So anyway.
Well, I wanted to ask one more question.
She was finishing a thought. I just want you to finish that out. You said it depends what you are using. So we were discussing condoms. Finish that out for us.
No, I was saying, it depends on what you're using it for, like the protection for. Are you protecting yourself against pregnancy? If so, and you have a long-term partner and a latex allergy, just get on birth control. That's easy to do.
Do you have any preferences? I know people are really always worried about birth control and what's best for us. What's your favorite?
So what I will say is if you ask any OBGYN what they prefer and what they actually have,
tell me,
it's going to be a Mirena IUD.
So what's crazy about the Mirena is you have the 3-year, 5-year, and 10. Is there a 10-year one?
There's a 10-year one.
Also, there's another commercial coming out. It's
Kylina.
Kylina. How
That's
do you
a 5-year.
compare? How do you compare the Kylina to the Mirena? And also, it still does have hormones in it,
does
correct?
have hormones.
Okay, so to me, that's my issue. So my skin has just got under wraps, and my weight is now under wraps.
Okay.
And those are two things that when I tried the shot, that it affected me.
Yeah, the
like,
shot
fat as fuck,
definitely.
dog.
The shot is gonna make you fat.
But not only that, it did affect my moods a lot. And my friend, she claims her breakup because of the birth control.
Well, the good thing about the IUD is that it is intrauterine, meaning that it just sits in the uterus, and the actual hormone that goes throughout your bloodstream is very low. So most people, experience a lot less side effects with the IUD than they do like the Depo shot, Nexplanon, things like that, or even the birth control pill. Can it still have side effects? Yes, of course. Like the most common, some people, have, cramping. Some people can have skin, dry skin, acne,
I heard that
things
shit is
like
painful
that
as fuck
to put in. But after that, you don't even know it's there.
So I fucked 10-inch dicks plus. Is it going to reach
It's
in
not-
there and
nope,
tilt
it's
it
not
at
gonna
all?
Niggas be
move
feeling
it.
it though. They say they feel strings.
They feel the copper thing,
so
right?
if the strings are cut too short, then basically they poke out of the cervix, and then they can. But
I'm good.
I've taken swabs from people's vaginas who have just been cummed in, and then I put it on the slide, and I see them sperm still swimming. So they are. Yeah.
Plus, like turkey
Yeah.
baster shit, bro.
Yeah.
Like one
So
of my homegirls
they're-
got pregnant with her wife through baster, like L word shit, and I was like, bro, how? Like,
How?
Yeah.
don't they be saying that? Hit
The
the air
sperm are
shit.
strong sometimes. They're strong. So
I
3
knew
to
they
5
was lying
days.
to us.
Well, really up to 7. Sperm can last for up to 7 days.
Sis, what? On a rag?
Not on a
Not
rag.
on a rag, okay.
But like in
you,
your,
swimming in you. That's
in
why
you.
with ovulation and like
Yeah.
cream
That's
pie
why all
shit.
that ovulation bullshit is some just bullshit.
No, but it's
Exactly.
You
not.
just gonna
They-
get
Because
pregnant.
you
All these
ovulate
babies born.
for a week. So like
So after you ovulate, you have 14 days.
That's particularly why. So these green dots, I use some
the
like
month is
flower
only 30.
period
We
app.
at 14 plus 7. God damn.
7 days of ovulation because the sperm can live in you for up to 7 days, right?
But you ovulate for 14.
No, you ovulate on day 14.
So you
Okay.
ovulate for 7 days, right?
You ovulate for
excuse
one
me.
day.
Your chances of getting pregnant are high in those 7 days because the sperm can swim and live
Exactly.
in your pussy for your ovulation day.
Exactly.
So you don't ovulate for 1, you ovulate for 7. Goddamn. Fuck
That's
that.
why people have the watch of the exact time that their body. Like, have you ever seen that with like women trying to get pregnant and they like,
Yeah, they
oh my
they
God,
watch like when I'm ovulating and
Yeah.
then they want to have sex right
So
before.
real
I
quick,
want that,
one
but to
more
use
thing. I
against
just
me.
finished watching Handmaid's Tale, and so the handmaids they were taught that after sex, so basically they would sleep with the commanders around the time of their ovulation. That's when they had to have the ceremony. And one thing that they said in this show was that I have to lay on my back after you come in me because I'm more likely to get pregnant if I stay laying on my back. Are there any truths to the positions of having sex and you laying on your back after you get come in to become
There's
pregnant?
really no difference.
There's no difference.
No, once the
Okay.
sperm are in there, they're gonna find their way. They
Even if you on a handstand, they just gonna go.
They gonna go. They
Okay.
gonna go. So
I got a little in me right now, but I ain't ovulating though. Had a wild morning. I'll tell you that. Plus, I ain't gonna front. When I'm like really tired of getting fucked, I already know what's like. I mean, oh my God, come in my pussy. Like I just know it's gonna work. So I'll be like, all right, now I can leave. Okay. Shout out to our listeners. I just posted only an hour ago and we have a lot of replies. So I'm handing my phone over to Dr. Kristina because some of y'all be asking some dumb shit. And I would really like her to answer the questions that, I don't know, might be helpful for someone else. Let's start with that prenatal DNA test though.
yeah,
Because this bitch don't know who her baby daddy is.
I do like
right.
this.
And
Thank
you
God
get a
it's
prenatal
anonymous.
DNA test, and yes, you can. The only issue is that the test in itself puts your pregnancy at risk.
How do they do it?
So they take a sample of the
The question,
fluid.
by the way, was can you do a prenatal pregnancy test so before the baby is born?
Yeah, and I guess it depends on how far along you are. So if you're less than 14 weeks, they can take a piece of the actual pregnancy
Wow.
and test the genetics of that. If you're
So he gonna miss a toe?
greater, no. Well, actually, you can. The risk to that procedure is that the baby can be missing a limb.
Now, I'm going to be
Yeah.
honest with you.
I mean, it's a very low risk. It's a very low
What
risk.
kind of
but-
limb? Or is my nigga gonna kill me? We might have to do that.
Yeah. Or you can find out between, anytime after 16 weeks, they can just take the fluid, some of the amniotic fluid, and test that. So
I wonder if it must be expensive.
He
as fuck.
really don't want to pay child support.
No,
He's like, is that my baby or not? Because, bitch.
I think that's a question for a woman needing to know. She's like, probably like, I can't go no 9 months.
Right.
Oh,
I need to know.
That's the only reason. Nigga, you can slow down and wait. But if I'm not sure, take the sack out. The fucking
Take
placenta,
sample.
bitch.
Yeah.
Get it
And they
now.
can do genetic testing
I don't
on
give
it.
a fuck if the motherfucking ear gone. Like Picasso. Take it. Whose is it?
I'm dead.
Bro, we had a home mail. It wasn't our home mail. The Steve Harvey one. Did you hear that? Where the woman said she was pregnant and it could be her son-in-law's kid.
Oh, I did hear that. I was like, what?
Now she need that
Now
test.
this is ridiculous.
A lot of BV questions. So you may have heard me talk about the tea tree oil suppositories. I really love them. I haven't heard any bad reviews on them yet.
Suppositories actually fucked me up. I tried one.
What kind?
It's I don't want to say it's Summer's Eve, but you could literally buy it. It looks like it almost looks like the Monistat.
Okay.
But you're supposed to like put it up in you and it leaks out. So it even comes with a pad in the box because you're supposed to sleep with it and then all the cream comes out. And so I did this when I was maybe like 18 or 19. And it literally fucked my whole
was it
pH
Monistat?
up.
Those balls?
It wasn't Monistat. It was a suppository. It's supposed to be like to make you fresh or whatever the fuck the case may be. The same with they actually say Summer's Eve can have a
Fresh
negative.
has a BV supplement. I know what you're talking about. It comes in a tube. It's a little pearl ball. I don't trust that shit.
Yeah.
Suppositories
I'm
I don't like.
specifically, well, I don't even know if I really even count that. Like, these are made from only natural organic products. I've used another one that I like for like dryness. I use it like right after ovulation or my period. It's at Whole Foods. I think it's Key E, and it's like coconut
It's a vaginal moisturizer.
Yeah.
Okay.
It's coconut oil based. Oh my
Yeah.
God, it's so soothing. Or if I have rough sex, I've used that. But I've also heard of boric acid suppositories from a few porn stars, and I've used them. And I didn't like them as much as tea tree, but I know that sounds scary. Do you know the best natural ways to cure BV?
Yeah, so I mean, boric acid can definitely cure BV, but it's not the best treatment. The best treatment is antibiotics. Boric acid are fine to use. They can be a little irritating because it's an acid that you're sticking in your vagina. Your vagina is already acidic, and your vagina is a self-cleansing, organ. So,
But with antibiotics, aren't you killing the good bacteria, and that's why people get the yeast infection?
You are. So a lot of commonly when you take antibiotics, you'll get a yeast infection.
Yeah.
So a lot of times if somebody has BV, I'll prescribe them both. I'll give them both an antibiotic
And a
as
diflucan.
well as a diflucan for when they have a yeast infection.
So I have a lot of sinus issues, and so I go to Jesus Christ, my specialist a lot just for ENT, and then also I've been dealing with a lot of dental stuff, and so so I normally do amoxicillin, and I actually told them that I get almost an immediate
yeast infection
with amoxicillin because it's an antibiotic.
Probiotics help.
And so they gave me actually just another antibiotic, and it gave me no issue with my vagina. It is clindamycin.
So actually,
don't they give that for not chlamydia,
strep throat?
because
Yes, I was about to say.
Yeah.
So I got clindamycin.
but it's also for an STD. And when I got to the fucking CVS, nigga, the dude is like, "Oh, okay." I was
Is
like,
that for? That's for
Clinda, it's not like a first line medication for any of the
Amoxicillin is, though.
STDs.
Yeah, well, amoxicillin is more of the generic.
It's like a penicillin. It's like sinus
but the
infections, ear
clindamycin
infections,
that I
things
took,
like that.
so it was for. So I was done with my amoxicillin. So I was on antibiotics and steroids because I got trismus, and they wanted to make sure I didn't get any blood clots and all the stuff going on in the back of my mouth. So when I told them, I was like, "Can I get a diflucan too?" They was like, they didn't want to just prescribe me the both, and I'm like, "My nigga, I know that when I take amoxicillin, my vagina fucks up." So they gave me the clindamycin. And I had no issue with that as far as my vagina. But yeah, I just wanted to
with
share
other
that.
antibiotics, can you talk to the good uses of probiotics for people and daily uses and like what they do for us?
Yeah, I mean, I think that what probiotics are designed to do is keep the floor. So your vagina has a lot of bacteria in it, right? That's normal. So the probiotics keep the floor of your vagina, what it needs to be so that you don't get an infection, because the bacteria in your vagina fight off other infections. So that's what they're designed to do. So I'm definitely I'm pro probiotics. They don't hurt. There's not really any good evidence saying that they can cure yeast infections or cure bacterial vaginosis or anything like that.
I've never taken them as a cure.
Yeah,
but I get
preventative
sick often,
things. Yeah, so preventative wise.
Last question, actually, two, real quick. This one. What's the name of the technical term for the walnut in the pussy?
I don't walnut in the pussy.
You know when you go in there, doctor, and it's
I called it the walnut.
It's like a baseball, man. You gotta
is what you touch, like when you're fingering, when you're fingering, specifically trying to get to a woman's G-spot, you get in there and you apply pressure on the top.
Look
and
at
then when
these
you
nails.
go like
Are you not scared while she's saying it?
I be putting these nails on
my patients would be like, oh my God, you
bro, I just got
down
triggered with a nail like that. I said only the clit. I'm sorry.
I put these nails anyways. So when you go in the pussy, this is if a woman's laying down and you go like this, you apply pressure at the top. When you curve your finger, kind of like you want to do the motion like this, you touch a part of the pussy that feels like a walnut.
Like a walnut. Okay. It's a gland. So basically, I don't have
like a muscle gland.
Okay.
It's a gland.
It's a gland, It's the walnut gland.
The final one, I fucking saw it and I actually liked it. Yoni steaming. It's a trend. Yoni beads are a trend. How do you feel about that?
Vaginal steaming, this shit. Right. Talk to it.
I mean, it is, if that's what you decide to do it. But, the thing about the vagina is it's self-cleansing. You shouldn't really be putting a lot up there.
Here's the thing. Like, people that are doing these self-cleansing things are obviously, in my opinion, they're feeling like something ain't too fresh. If they feel like the pussy ain't cleaning itself, then what? That's where I feel like everybody's fucking stuck.
You gotta change your eating habits or something.
So diet really does matter, actually.
Yeah.
Diet matters.
Because even with guys, or like even just outside of the genitals, if you eat a lot of red meat, your breath is gonna smell a different way.
Right.
When you
asparagus makes my peace.
If you're using a lot of spices, specifically when you're traveling, to like the Middle East or even
it can come through your skin.
It comes through your pores.
It does.
So to me, if you feel like your vagina has a stench or isn't feeling right,
switch up the diet.
I would switch up the diet first.
Spices last forever. I moved into an apartment once in Orlando. And I fucking went right to the realtor. I said, listen, I'm not trying to be a bitch. I need to know who lived here because this whole fucking house smells like curry and someone needs to paint. And it was strong.
I ain't gonna hold
the walls, bro. Did you paint the house?
Whole floor, my whole building is people from Bangladesh. And I moved into it and it smelled like motherfucking curry. And I said, if this shit seep through my door to where my house smell like curry, we gonna have problems. Luckily, I've been there about 4 years. I'm good. The curry don't seep through the door. But when I'm in the hallway, I got a problem that it smell like a whole goddamn
One
curry.
of my East Indian homegirls, I went to her house and she cooked for me and I said, once I got drunk, I was like, yo, I gotta say something. It's problematic. And she was like, it's cool. I was like, how come your house don't smell like other Indian houses, bro? And she said she be cooking the shit outside, bro. She's like, sometimes I'll fucking take it.
It smells strong.
But not only that,
Indian food once.
So smoking is one thing, but also cooking can change the colors of your walls. It can affect the paint. A lot of people that I know don't smoke in their houses, specifically cigarettes. Weed, not really, but cigarettes will actually give the paint on your walls like a yellow film if you're a smoker and you smoke in your house. So for people who smoke cigarettes, it is something that can not only affect how you smell, your clothes, and everything else, but it does even affect your house. And I know this because both of my parents are chain smokers.
So Yoni steam. I did it. I'm gonna be honest with you. I think it was just soothing. I don't think it changed anything.
I don't think it changes anything.
It was soothing as fuck. I'll say that though.
I don't think it hurts. I don't think it helps.
And it was real nice and spiritual. I set the tone. You know what I'm saying? I put that little pot right under my pussy, and I listened to some Sade, and I was like, this is a great and lovely thing.
I mean, the one thing I think that people should stay away from is douching. So those over-the-counter douching things like those will give you a bacterial vaginosis infection.
Really?
Yes. And once you do
so there's no brands. Summer's Eve, that bullshit.
All that douching, don't do it. Please do not.
Okay, know this, bruh.
What about enemas?
What kind of enemas?
The enemas that will clean out your ass.
Those are fine.
But that comes
out.
out.
Those are fine.
And colonics, those are fine.
Those are fine.
But the shit in your vagina,
in
just
your
don't
vagina,
do it.
don't do it. Because once you get one BV infection, it just keeps coming back.
Do you have any preference on? So I use M.D vaginal wash from Whole Foods. The Honey Pot. I know I believe female and Black owned. Do you have any suppliers that you want to shout out or you use or that you like? If you don't, cool. But
I mean, I don't. Honestly, I just use Dove soap. Like, just clean it out.
External washing only.
External washing only. You don't need to wash your vagina. You don't need to wash your vagina.
Correct me if I'm wrong. When I wash my vagina, I use the M.D on the outside. And then on the inside, I don't use soap, but I do use my fingers and sometimes wash from the inside. And I spread my lips. I clean around. I've also read about what is the men get it, that dick cheese. It starts with a P. Maybe it's.
I don't know.
Damn, I know this guy.
You don't, and your
schmegma.
Schmegma, and your clit can get it fucking too. So I always make sure to wash there.
Yeah.
When washing, hands, rags. What do you?
So the textbook will tell you just use your hands, but use a rag,
right?
Get
I think white people just be washing with their hands. They don't even wash their legs.
Exactly.
So,
you gotta wash all over.
I know that, and it's funny because I have the debate with my friends all the time. Like, I don't remember who I was just with. Oh, I was at a fucking table with Tahoe and Dodge and all these was Mouse there? I think no Reek. So we're at a table and she's like, no, fuck a rag. You need to use the gloves because there's no way. So there's gloves that you can buy that you wash. So we're literally talking about all the different ways to wash your body, and they're like, well, you're not clean if you don't use a rag.
Yeah.
But then she's like, the rag is dirty, so you got to use the soap, the glove to get into the crevices.
I mean, I do recommend using a different rag every day, obviously.
Every day.
Yeah.
Gotcha. Damn, that's a lot of washing.
I know, but it grows bacteria. It's in there wet.
You're right.
Okay. Changing it out.
And what about towels? How often should you change your towel? Daily as well? Or, because it just dries you off?
It dries you off and you're technically clean if you clean your legs and things like that. You're clean.
Yeah.
Okay.
But, so I usually say once a week, change out your towel.
Okay.
But
perfect.
Definitely change it out.
This was so informative.
Good.
You was answering shit. I like this.
I know you guys are going to like her. Yes, she's cute. So tell us your type because niggas going to want to know.
Let's see, my type. Oh,
money.
Okay. Yes. All right.
Start it off with
the facts.
I'm actually kind of sure I'm 5'2", but I do like tall guys.
She's 5'2".
Yes.
But she wants your check. Do you need them to be local to Jersey or New York?
They don't have to be local. No, they don't. I like beards. I live in Philly. I do live in Philly.
Oh,
I thought you said Camden, Jersey. I'm sorry.
All got beards there.
Well, I work in Camden, New Jersey. It's very close.
Very.
Okay.
I do like beards.
I guess.
Do you like women?
I don't like women.
Okay. You said you like beards. My nigga got one.
Do you have social media or a website or anywhere where maybe our listeners can reach out to you?
Yeah.
Or if they're looking, for a Black OBGYN in the tri-state area,
absolutely,
you are someone that they can reach out to.
Yes.
Of course, if you accept their insurance. But what website or where can someone find you if they wanted to reach out to you?
Right. So my Instagram is K_Willie. That's K_WILLI. And I practice in Camden, New Jersey. So, you can just Google me, Kristina Williams, Kristina Williams, MD, Camden, New Jersey.
Hey, she said
You'll
MD.
find me,
Look her up on LinkedIn.
Be professional. Y'all niggas be in the DMs like, yo, so I got this going on. Don't send pics, bro. God damn, make an appointment.
Make an appointment. Come see me. I am a little backed up. It takes about...
she booked it busy.
No, it takes about 3 months or so to get an appointment.
Okay. Excuse me, young Black unicorn OBGYN.
K_Willie, WILLI.
I want to make sure we put that in the description for this episode.
I'm
definitely
so
reach out to her.
Honestly, I've been looking for. I actually was like, yo, let me get an RN. All these Jamaican bitches that follow me, goddamn, y'all hoes curving the fuck out of me. I know one of y'all could come and help, and nobody wrote me back but you at 2 a.m. or something.
So the funny thing is, I was actually at Trap Karaoke in Philly, and Mouse Jones is the host for that.
Yes.
Right? And so I was like, I was introduced to him through you guys' podcast. So that's how I knew who he was. And I was like,
hey, nigga, we need a cut. We need a cut out the karaoke tickets, nigga.
Give us a percentage. When you wrote me, funny enough, I was with his girlfriend.
Oh, really?
At a bar, wasted. And I was like, oh my God, I was so excited. I was actually with my dude, actually, we're about to leave with this bitch. I was like, oh my God, I found a doctor. She's black. Oh my God. Y'all, I was so happy. I was screaming in the bar. So, at K_Willie, WILLI.
Yes.
We're going to put it in the description of the episode, like Mandy said. Thank you so much for coming on.
I really enjoyed this.
Thank you. Yeah, I do also want to give a shout out to all of our patrons. Because of you, we have merch on our tour. Because of you, we have a lot going on. And I just want to thank you guys. Also, for those of you who are not patrons, we do give 3 bonus episodes out per month. So you now have 7 to 8 episodes on any given Monday during the month if you are a Patreon. So as always, we're going to leave you guys with a 5-minute clip from one of our bonus episodes. And if you want to listen to more, make sure you become a patron at patreon.com/horrible decisions. We are an 18+ platform. We post porn. We dive into more of our personal lives.
Our porn.
No, not our porn. No, it's not.
Yet.
It's not our porn.
For this pussy to become OnlyFans.
But we do post, just things that are 18+. So because of that reason, you can't just go on to patreon.com and search us. You do have to type in patreon.com/horrible decisions. It is in the description of this episode. And again, we're going to leave you guys off with that. So thank you, Kristina.
Thank
Dr.
you.
Kristina.
Thank you.
For joining us. And I hope that you guys appreciated this episode. Y'all know I'm all for the education, so I'm glad that Weezy was able to lock you in and schedule you. So once again, this has been yet another episode of Horrible Decisions. Bye.
Bye.
Someone just sent a question in that said, what's the inside of a vagina like? A dark hole? Can you ask her?
No.
What?
Right.
No, we're not asking that question.
What?